Hey, I've got some exciting news. So Jeff Bezos, Richard Branson have gone into space. You know, in a couple of years, we might actually get humans to the moon. We might just see that in our lifetime.
For the first time ever.
That would be a really, really big step for mankind.
Jordan Finewax is currently a customer success manager at SeamlessMD. He joined the team in September of 2020 with a background in health tech sales and marketing, working with optometrists and ophthalmologists across North America to supply a device that enhances vision for people with vision loss. In his role as the customer success manager, Jordan works with a variety of clients across North America in such specialties as cardiac, hernia, urology, hepatobiliary, and most recently, a big grouping of orthopedics for hip and knee replacements, specifically in Ontario, Canada. Jordan has been SeamlessMD's representative to provide support and insights to Ontario hospitals, most recently through the Ontario Health SeamlessMD user group meetings. Jordan is hoping to continue to leverage the collaborative nature of healthcare providers within the province of Ontario to further provide excellent outcomes for patients throughout the healthcare system. When Jordan's not working, he enjoys cooking. And just a side note from myself, Jordan is actually a phenomenal chef. He probably won't say that because he's so modest, but he is. And he also runs a food blog with his wife, and he cycles excessively. Jordan, welcome to the show.
Thanks for having me, Alan and Josh. Hopefully I have some insights today, but I think it'll be more so a good conversation for people to hear.
Awesome. Welcome, Jordan. Thanks for taking the time.
Yeah, my pleasure.
And definitely, Jordan, I know you'll have some big insights because you do work really closely with all of our customers, or a good section of them. Maybe to kick things off, Jordan, just for folks who are unfamiliar to the topic of surgical remote monitoring solutions like SeamlessMD, could you describe how that type of technology works to a healthcare provider who is unfamiliar with the concept?
Sure. I would say surgical remote monitoring is really a key tool to help connect providers and patients, as well as improve patient experience all the way throughout. Right now, after surgery, when patients go home, there really isn't that much insight into what's going on in that patient's life, unless something adverse happens. They're having a complication, they're having a wound issue, and it's really difficult for the provider to say, hey, we need to be monitoring these different issues. What surgical remote monitoring really allows is that connection from patient to the provider, to the surgeons, to the rest of the healthcare team, to follow along that patient's journey, and really, I'd say, intervene at the right points and hopefully find some issues ahead of time so that patients are recovering better over time, they are recovering well, and don't have to, come in to the hospital for an ED visit, for a readmission, for any other adverse effects.
And Jordan, I know we talked just now about the value of this experience on the post-discharge recovery side, but I know you've worked with a lot of hospital partners on using platforms like SeamlessMD on the pre-operative preparation side as well. What sorts of things are you doing at that point with the patient?
Yeah, really great point. The preoperative side is just as important, making sure patients are prepared for surgery. There are so many lists and so many items for patients to go ahead and do, whether it's stopping certain medications, performing certain exercises, ensuring that they have all the materials and even hospital items packed, ready to go. This alleviates a lot of potential canceled surgeries for some of those more complex surgeries, thinking of CABG valves specifically. Even being able to check in with the patient ahead of time. Have you received all of your items, like your chlorhexidine wash? Have you gone ahead and gotten all of your supplies needed for after, when you need a cane, when you need a walker? So really preparing that patient ahead of time to reduce anxiety, ensure that certain surgeries don't get canceled themselves and procedures don't get canceled themselves, for those more important factors like those blood thinners, those anticoagulants, those anti-inflammatories, ACE inhibitors, anything like that. So really great way to bring the patient along 3 weeks, 4 weeks pre-operatively, and get them up to speed so that they're really well prepared for that surgery and know what's going to happen.
Yeah, awesome. That's phenomenal. I know that a lot of our partners in Ontario, work closely with you. I know you're working with the folks at Thunder Bay, Health Sciences North in Sudbury, a number of others over the past, probably at least 6 to 9 months, maybe longer. And they've kind of, implemented SeamlessMD for surgical remote monitoring, largely because of the backlog in surgeries that's happened in the province. So I think as of a month ago, the government said there's now over 400,000 surgeries in the backlog in Ontario. It's going to take a couple of years to clear, and a lot of these partners are using Seamless to help clear that backlog. Could you talk a bit about maybe some of the ways in which Seamless helps with the backlog for surgery?
I think there's a few things that's really helpful in clearing that backlog. And I think the numbers are actually specific to hips and knees, around 40,000 combined of those surgeries in the backlog. We're really here to help those hospitals, Thunder Bay, HSN, Timmins, Sioux area, improve their same day surgeries so that they can actually go ahead and get people through the doors quicker, but also not necessarily dip in terms of patient quality of life, making sure they're still getting through and monitoring their symptoms, managing their pain accordingly, not coming back through the emergency department or for a readmission, because we're able to have that touch point with the patient and allow themselves to monitor their own symptoms and signs and warning signs of what could be complicated. The ability to keep patients out of the hospital after they have come through that surgery just allows for quicker surgeries, more turnover, allows the surgeons to really focus on the patients that are in there at that time. Even for some of the more, I'd say, complicated surgeries, reducing that length of stay, giving patients that prep that we mentioned beforehand, but also allowing them to recover in hospital, ask their nurses for help, know what's expected of them, to reduce that length of stay from 4 days down to 3 days. I mean, if you can reduce something by 25%, the idea, hopefully, even though there's a limited amount of beds, is being able to put more and more patients through. I'm thinking specifically to, hepatobiliary area that has 4 or 5 days length of stay. That's really where we come into play, and other, surgical remote monitoring can help clear that backlog in general.
Yeah, I think one of the interesting things I've found is that when people think about surgical remote monitoring, they often only think of the post-discharge monitoring at home side. But then earlier you talked a bit about the pre-op side, and just now you touched on, hey, actually, while you're in hospital, even if you're having a major surgery where you might be in the hospital for several days, SeamlessMD is on your device and it's prompting you to mobilize earlier, start doing your breathing exercises, checking on your pain. And it sounds like that makes a big difference in helping the patient recover faster and be motivated to safely get home.
I think the other piece in there is setting expectations for the patient. When we say you're going to be going home a few days after surgery to follow ERAS protocol, and we tell patients, get ready to go home after 3 days, even if their typical length of stay is 4 or 5 days, that mental awareness for the patient time and time again has proven, not just from Seamless, but across the industry, that it allows patients to get up to speed faster and get out of the hospital quicker. So having those reminders, having those potential issues at their fingertip, even though they're in the care of their great nurses all around the hospital, that extra sense of, I have something here ready to go. My family can read through these things, and I say with my family by my side, oh, I'm feeling a little discomfort here. Oh, let's see what the app says. Let's see what's going on. It seems like it's normal. Hopefully we'll have you home in a few days. Really just pushes the envelope in clearing out those beds quite a bit quicker. Hopefully that's still yet to be determined for some of the hospitals, but that's a big hope of ours.
Mm-hmm. Yeah, definitely confidence all around. Provider confidence, patient confidence, family confidence. Now, Jordan, you actually named a number of hospitals who you've worked with, and you personally actually led the implementation of this surgical remote monitoring across many different organizations in Ontario, like you mentioned Thunder Bay, HSN, or Timmins as well. Could you walk us through sort of what that overall process looks like from when you kick off the project all the way to the go live when the project is, or the project's actually launched?
For sure. I'll take it actually one step back, is really pre-kickoff. We're gathering the materials that are necessary for the patient pathway, making sure we're gathering all of the guidebooks, the patient handouts, and also ensuring that the surgeons understand what's going to be required of them and their team, so that everyone, again, expectation setting, knows that there's going to be work involved over these next number of weeks. At the kickoff, we usually grab a very large grouping of the surgical team, the care team, so surgeons, inpatient nurses, outpatient nurses, PT if physiotherapy if it's needed, occupational therapists if they're needed, dietitians. We really grab the entire group, present to them what we're hoping to be able to build, and run through a demo of their potential pathway. We have a lot of templates that we show them, so they're never starting from scratch. A question we get all the time, and walk them through what Seamless is able to provide, what Seamless is going to be able to do. And then we work through, all right, how do we get from this template we have to working through all of your protocols, all the information that you already provide to patients. And that's where those next 4 or 5 weeks are extremely intensive for the healthcare team. We're looking at reviewing dozens of content pages related to wound care, related to pre-op information, related to in-hospital information. We're looking at different reminders that go out to patients to ensure that they're following suit and have the appropriate information at the right time. We're also looking at the recommendations for patients. If a patient is reporting, I don't know, potential signs of a blood clot, do we want to direct them to the ER? Do we want to direct them to the ED? Or are these ones specifically, maybe we want to have them call the surgeon for whatever it may be. Those 5 weeks are basically our building time, 4, 5, 6 weeks, to get everything in order with all the different groups. And then we come back to the table and say, okay, you saw the demo we first did at kickoff. Why don't we go ahead and show you everything we've worked on, all of your protocols in place. And then there's just a little bit of a review back and forth afterwards to launch the program. Before that launch is where I come into play a lot, is ensuring there's buy-in from the rest of the hospital to understand how Seamless is going to be used, training for enrollment, training for how to use Seamless, what's going to be the best way to monitor. And then the last thing that's really important is really fleshing out, are we going to be using an alert system? I've seen from programs so many different arrangements. For example, some programs, they'll have a couple of nurse practitioners as well as a medical clerk that's seeing the dashboard and getting alerted of some of those more intense patient concerns. Others, they just have, and I don't mean just because it's lesser, I mean simply they have a single person who's an RN overseeing the platform for many, many different programs. And it's really on us during that implementation to finalize and understand, what do we want to be alerted of, who's going to be use it, how are we going to use it. And once we launch, that's when patients get enrolled and we can start looking at, is this doing what we need it to be doing? I know I touched on a lot of things there, but it's never a starting point and an end point. It's always continuous and always flowing on improvements.
I did have a question just about the alerts that you mentioned, just to unpack that a little bit. So these alerts are, just for folks who are unaware, these are looking at post-op symptoms or symptoms that a patient is reporting. Can you just touch a little bit more on what the alerts are that some of the groups are looking at? You don't have to get specific in terms of like actuals, but.
Yeah, so we have the ability to set up an alert for anyone who's monitoring the platform. Those alerts can come in a variety of ways, whether they want them by email or just on the SeamlessMD dashboard itself. And these alerts can be anything that the team says, I want to know about this. For example, really important patient concerns like signs of a blood clot, wound infection, really, really high pain scores. But sometimes it's other things that help the overall experience. I know a couple of hospitals, they actually want to get notified when a patient is asked, did you use any of these other healthcare services? We ask patients that at the end of each survey, and in one of the answers, it says, I visited an ED room. Well, if a patient's reporting that, the team said, if we can follow up and find out why they went there and potentially stop them another time from going, it's a really easy thing for us to do. Beyond the post-op care, certain programs even have some pre-op reminders. If patients are, if they do have a pre-op survey as part of their program. They can ask questions like, did you pick up your chlorhexidine soap? Do you know where to get all of your information? Have you signed up for physiotherapy for after your surgery? Can get alerted on those too, so that we can continue to provide that fantastic patient experience and not delay surgery, so that we're continuously clearing that backlog.
Mm-hmm. Yeah, great point.
And Jordan, I want to follow up on something in the implementation. So obviously, your team in customer success plays a big role in quarterbacking that process. You obviously work very closely with our patient education team as part of the implementation. And for those who aren't familiar, our patient education team is made up of folks who have different clinical backgrounds. So they might be a nurse, a pharmacist, a health communication specialist. And they're heavily involved, I guess, in the clinical configurations of the content of the protocols with the frontline staff. Jordan, can you maybe touch a bit on kind of the role that team plays? Because I think it's actually quite unique. Like most, I think, companies in the digital health space are purely business, engineering, customer success people, and not really a lot of people with clinical backgrounds. And that's kind of special, I would say, in our approach. Could you maybe tell the audience a bit more about the role that team plays?
Yeah, for sure. I'd say everything that I was explaining about that implementation, customizing the reminders, the protocols, I don't do that. I don't do the heavy lifting there. And I always say that it's our patient education specialists that are working through the materials with that clinical background to build the program, to build the platform, to make sure that it's not only all of the protocols in place from all of these patient education materials, but it's also, they're working through accessibility concerns. They're working through creating things at a grade 6 reading level so that more patients can have access to it and understand what's happening with them. They really quarterback, I'd say, that entire piece up through to launch, other than the training. And it's great to be able to work with them. I think what's interesting at Seamless, like you mentioned, is sometimes it's one person in many other organizations. The ability to work in a team, even that I don't have clinical knowledge, I'm bringing up my level of clinical knowledge through all of these, which I love about Seamless. But B, what's really helpful is they can bounce ideas off someone who may not know as much. Says, does this make sense to someone who has less knowledge? Does the logic make sense here? Do we have everything that the team has checked off on? And I think it creates a really great atmosphere, knowing that there's a clinical side, someone with that clinical background, especially, we have a few dietitians here at Seamless, being able to relate to how important the dietitian is at these different hospitals for these programs, just creates that extra layer of, we're really in it for the patient. We're really trying to create this best experience for you as the provider, but really for end user patient. And I think it just really ties it all together that way.
Mm-hmm.
That's awesome. And Jordan, I know one of the things that you and your team do is you actually engage a lot of the stakeholders at the organization, right? You're not only engaging just the nursing team or just the surgeons, you're engaging all kinds of folks. Could you touch a bit on kind of the types of stakeholders that you're choosing to involve in the implementation and why that sort of broad engagement is so critical?
I think the broad engagement is so critical because, well, first off, the more knowledge there is, the more patients hear about it, the more top of mind it is, the more use patients get out of it, and eventually create some really great statistics, whether it's reduction in all of our lovely statistics. I'd say some other stakeholders that we look to include, whether it's in the program development itself, there's always external stakeholders, looking at whether it's the C-level, whether it's other players that are looking at bundle care, specifically, people really involved in the patient process after the fact that may not need that 4-week timeline, but those physiotherapists are so appreciative to at least be able to see and understand what their patients are going through to further help them. I'd say there's even the psychology teams, the dietitians, department heads, to see what are we doing for this group that can be translated to other groups. And I think that's such a key factor of showing and giving someone else an idea. I can tell you that I think it's going to be beneficial for your patients, but it's these C-levels, it's these other department heads, chiefs of surgeries that need to say, I'm looking at this and I see some real value for me, whether I want to do a research study, whether I need to continue to, reduce costs in certain areas, and this is going to help me hit that mark. There's so much that goes around with it that I think is just, so important to continue to engage on that front.
I think the other piece that I've seen over the years is just that that sense of ownership of the initiative and the program if you were part of the implementation. So, I think we've seen cases where because we engaged the physiotherapy team, they said, hey, Jordan, I have these great physiotherapy videos that I want to make sure are in the platform. And then they're excited to make sure patients are aware of it so they can use it. Whereas if we didn't engage all those providers, they wouldn't know about it. They wouldn't be as motivated to share it. So it's almost that if you're part of it, you really care about it. I think that's really special.
I think another really cool piece is patients are prompted through different surveys also to share their thanks. And sometimes it is those periphery team members. I can recall at least 2 or 3 occasions where patients are specifically calling out anesthesiologists for their bedside manner, for how much they cared. We've had the anesthesiologist at these kickoffs, at the demos, reminding them that it's launched. And then to be able to come back and say, hey, take a look at this. These are what patients are saying about you, about all the great things you're doing. Just that extra level of look what Seamless can provide in helping these people who don't usually see patients afterwards. Anesthesiologists, it's one and done for the most part, to get these unbelievable comments trickled back into them and involved. It's, I think positively, I know surgical remote monitoring is providing this value and benefit. Our patients are loving it, and they're even telling me how much I'm helping them. So I can continue to do better at my job. I can feel good about what I'm doing and continue to just promote and stay within a hospital system.
I think that kind of positive feedback loop is so important. Number one, because normally in healthcare, you only hear about complaints, right? So usually if you're an anesthesiologist and you're hearing about something, it's often a complaint that's been filed, or that's for any physician, right? But I think so getting some positive feedback is really, really nice to hear. And then the other piece is during the pandemic, any positive message is just so meaningful. These frontline staff are working so hard to fight the pandemic, and knowing that we're playing at least some small role in providing that positive feedback loop is really nice to hear.
Yeah, couldn't agree more.
So Jordan, you were mentioning how, broad across the peri-op, spectrum, all these different stakeholders who are involved in the initiative. It's also really broad in terms of surgical program and clinical areas that surgical remote monitoring, it's really just remote monitoring has kind of entered, especially in the past year. Could you talk a little bit about how broad it is, the areas that you've rolled the technology out across departments? And in particular, are there certain benefits that you're seeing in one area versus another?
Yeah, for a lot of my hospitals, not my hospitals, the hospitals that we work with here at Seamless, mentioned a lot in my intro, but we have orthopedics, so hips and knees, we have shoulders, we've just launched a spine program for fusions and decompressions. We've launched hepatobiliary, so liver and pancreas, breast cancer, colorectal, bariatrics. So lots and lots of areas that go ahead and cover. The areas that I've seen the most so far are the ones that we've really dug deep into the numbers. We may still be waiting on a critical mass of patients to come through some of these other programs to say, hey, we're really benefiting. The ones that I've seen the most time and time again are those orthopedic patients. The hip and knee replacements, even if they are same-day surgery now, the reduction in the patient satisfaction for the first point, rave reviews about what this program is able to alleviate anxiety, share with their healthcare team what they've been doing, but also in the numbers and statistics. And I know we were going to talk about it eventually, but I'm going to bring it up now. The reduction in ER visits in the North is such a key critical role that we've been able to do. So many patients would go for minor bruising. They go for aches and pains. They go for any little thing that may come up. And now with the ability to see what they're responding, reach out to them because it's alerting a nurse practitioner or a nurse and say, either A, that's normal, or more importantly, B, let me get you something that you don't have to go to the ER for, is just an absolute success overall. And I think that's where the value comes in, is being able to normalize patient fears, normalize patient concerns in general, and help them understand what is really a concern to me and what can I probably still go forward with, and not have to make my way driving 2-3 hours to an emergency department to get fixed up.
Mm-hmm.
The other piece too, I guess, Jordan, I know we've seen that with some of the patients providers you've worked with, is that there's that subgroup of patients who don't want to come in for stuff. And so if something really bad has happened, I know there's been some stories where Seamless and your provider teams have helped actually bring the patient in for a very serious concern they were going to stay home about.
Yeah, definitely works both ways. It's really being able to have eyes and ears, right? That's the whole point of remote patient monitoring. We have eyes and ears at home for all of these patients to say, this is a concern, this isn't, let's really continue to focus and find the patients that need help.
One of the things I just want to talk about, because Alan brought up the different surgical areas you're working in, you've actually gone pretty deep in terms of like the data that we're tracking with patients depending on the type of surgical areas. I think, for example, for like a total knee replacement, you're tracking how far the knee can bend. And for, I think, colorectal, we're often tracking stoma output. Can you talk a bit about kind of why that sort of, I guess, customization or specificity to different clinical areas matters? I mean, we could just give a very generic program to every patient, right? But it sounds like that makes a difference with engagement and monitoring to be that specific.
I think from what I've heard, on two fronts. Firstly, surgeons, the ability to take this information, whether it's wound pain, and changing their practice to providing nerve block catheters, and being able to really push forward on patients' pain, is one big piece of the puzzle. But some of those other more specific areas, flexion and extension, stoma output, patients are able to track, they're able to bring this up to their physiotherapist, they're able to recover quicker, and track it along the way. So I think it's really important just to see, how are patients progressing, and patients want to be able to measure something, right? They get asked these things all the time. Are you nauseous? Are you feeling okay? Are you this? But when a patient sees their own mood scores, their own anxiety scores, their own flexion and extension scores, there's a sense of pride. There's a sense of, I've done more than yesterday, or I can push to get further. And I wouldn't be surprised if, not that we have the data on this, but I wouldn't be surprised if we looked at all of these programs 1 year ago today without Seamless, or 2 years ago today without Seamless, and measured flexion and extension, even with the amazing help of the physiotherapist. I wouldn't be surprised if there was 2, 3, 4 degrees more on each of those, flexion and extension, because of this is where you should be, this is how you can keep going, and patients being able to track it every day, just like that.
Yeah, Ron, so what's that phrase? You improve what you measure?
Manage and measure. That's what it is. You can't manage what you don't measure.
You can't improve what you don't measure. Is it manage?
Yeah, the actual
quote
was
right?
manage and measure, but the point is the same. Yeah, you can't make an improvement if you're not tracking it.
There's a really specific phrase for this, and
yeah, it's Peter Drucker. I just can't remember what the actual quote is. What you don't manage, what you don't measure, you can't manage.
I think someone's got to Google this.
Yeah.
I'm gonna Google it now.
We're at the point now where we need to know.
You can't edit this. This has to be an unfiltered.
I'm not Googling it. I'm leaving it to you two.
I think Josh is on it.
I've seen what gets measured gets managed.
That's
you can't manage what you can't measure.
I like the positive spin on it though. What gets measured gets managed.
Yeah, that sounds good.
Yeah.
Oh, although Peter Drucker is often quoted as saying, you can't manage what you can't measure.
Yeah.
Anyways, that's awesome. Jordan, I was curious about, in terms of your recommended best practices for getting adoption of remote monitoring, because I mean, all the time, Alan and I hear, concerns about, I have, older patients, or, how do I know they'll be comfortable using this? What do you advise in terms of best practices for getting high adoption?
I think it's a concentrated effort. I think, there's the old adage that if you don't know a brand name, or you don't know the name of something until you hear it 7 times. And I think that's really the key effort here. It's having a structured way of enrollment, whether there's a single body responsible for calling out to patients, explaining in detail what Seamless is, or meeting them in clinic if you have that ability, depending on COVID practices, and then reinforcing it several times throughout. Surgeons reinforcing it makes the biggest difference, but it's not always top of mind for them, and we know that. But the ones that do, we see engagement through the roof, and then as when engagement is up, we obviously are able to catch those issues sooner and quicker. I'd also say one of the best things, it's all resource dependent, but follow-up calls if possible, really being able to reach out after the fact. Maybe it's scheduled, maybe, a week post-discharge, being able to follow up and say, how are things going? Having that effort done throughout the entire hospital, where there's posters, where every single one on the floor knows about Seamless. That's what creates an amazing experience for the patient. That's what gets them saying, everyone's telling me about this. If I don't do it, I'm gonna miss on something, or something bad is going to happen. Hopefully it doesn't, but that little bit of everyone telling me this makes the biggest difference. And that's what I've seen at most of our hospitals that have, that call out, that reinforcement when they're leaving the hospital, that reinforcement after the fact. And that's really what makes the biggest difference.
That's a really great point, Jordan. I think sometimes there's wishful thinking that remote monitoring is a magic pill where you just have to give out flyers and not say anything else about it, and magically your length of stay will go down, your patient satisfaction will go up, magically readmissions go down. But as you're describing it, it does take a real commitment from the organization to the initiative.
It's also a little bit of a catch-22 at some points. Whenever we get started with the program, obviously engagement, we haven't had that critical mass pushing forward as much as we can work on training and engagement on the provider side. But all it takes, and I've heard this several times, all it takes is a patient coming in for their post check-in visit to say to Dr. So-and-so, that app was amazing. Like it was fantastic. I got so much out of it. And they hear that 3 or 4 times from patients. It works the other way around too. Once they start hearing it, then it's coming out the other end at the beginning of the, consult, the beginning of the surgery of, you're going to use this when you leave, right? It really works in both ways.
Yeah, that's great.
That's a fantastic point.
So, and I think, above and beyond the ED visit reductions and the readmission reductions, there are other clinical success metrics, or not even clinical, just success metrics that are kind of like early indicators of success for, let's say, readmissions or ED visits. Could you talk a little bit about what some of your partners are seeing in terms of success, and what you're measuring specifically with your first kind of go round of, let's say, the first 3 months of implementation?
Yeah, I'd say the main ones, always top of mind, like you mentioned, are those ED visits. We're looking at readmissions depending on what kind of grouping it is, but there's also a lot of qualitative items. For example, there's quality of life surveys that certain programs have, where we're measuring at different time points, pre and then several times post-operatively, the quality of life of the patient through some validated surveys. We're also looking at actual patient satisfaction metrics. We ask in Seamless, did this program help you feel more confident before surgery? Did it make you feel less worried after surgery? And being able to plot this out on a graph and show a percentage of 90% of patients are saying this helped me, and even some going so far as saying, I had my knee replaced 2 years ago, and now with this program the experience was 10,000 times better. Those are the things that a lot of our programs look for as, are we hitting the mark? Is this the platform that's going to be for us long-standing, because it provides clinical, and it provides the clinical outcomes that we're always hoping for, but also are patients actually enjoying it? Can we really say, for the matter of the fact that this is helping patients straight from their mouth? I'd say those are kind of like the 4 or 5 things and metrics that we're really looking at in terms of success, on the monthly, on the quarterly.
Right. I just love the fact that, patients do talk about their experience as well. And like you were mentioning before, where they bring that feedback back to the surgeon and they're letting them know, like, yeah, it was such a positive experience. I just think that's phenomenal.
If you give, and I've noticed this, I didn't think it would be true because I'm not a person to fill out so many surveys myself, whether I've gone through, shopping is much different than healthcare, but if you put something out there for a patient to have a free text answer on what's been happening, how they've been feeling, etc., they're going to write something. And, there are definitely negatives and we're able to address those, but the positives are just overwhelming of patients saying, this was the thing that really helped me through.
One of the other things that's caught my eye with some of the feedback we've seen has been the caregiver feedback. So often, it's a loved one who's using Seamless either with the patient or on behalf of the patient if the patient's maybe much older or frailer and can't, take care of themselves on their own. Jordan, any feedback on what you may have heard or seen from caregiver feedback?
In terms of caregiver feedback, it really depends on the location. Being able to enroll someone alongside you or instead of you, because you may not have the technology at your fingertips, which is very apparent in many different communities, whether it's here in Toronto, remote up in Thunder Bay, Sudbury, Timmins. For the most part, the caregiver are extremely satisfied. The idea that they can follow along with their, whether it's their partner, their mother, their grandfather, the feedback is overwhelming to be able to say, I feel connected. I feel I know what's going on and I can help assess with them. Is this something that requires additional support, additional intervention?
Jordan, I think we also wanted to touch on this really exciting Ontario Health user group that was started, I think maybe 5-6 months ago. Could you tell us a bit about what that is and what you do in those meetings?
Sure. Yeah. The Ontario Health User Group was brought together to really look at Seamless as a whole, understand what we're doing in all of these different regions. It really started with actually the Northwest, Sudbury, Sioux area, Timmins, and Thunder Bay. And at those meetings, we would really look to see how things are going in our implementations. Are there best practices that we can bring along? Are we able to align surgeons better? Are we able to align internal members better? And a lot of discussion points around that. We've also had a lengthy discussions around translation being accessible to other communities, whether it's French or Indigenous communities. And then it actually grew a little bit more from there. We have a lot of, GTA, Toronto-ish based hospitals where once a month or once a quarter, we'll be getting together to look at some of those same items, but on a larger scale. And most recently, just before the summer, break for all these hospitals, as people are going on so many different vacations and holidays, one of the big things that we were able to bring to the table is some comparisons, a little bit of work on understanding how are you doing compared to other hospitals. I can tell you from customer success, everything looks great, but everyone needs to know at some point, how do they benchmark? So we looked at things like we normally do, wound scores, recommending the program, call, visit avoidance, flexion and extension. And there was a lot of buzz around that, just understanding where everyone sits. The goal is to really take that even one step further eventually and have that as standing on its own operation with all different user groups, all different Seamless members, whether they're in Ontario and beyond, to continue to compare and then really dig into why someone is doing something better, how they are doing things better, and share that knowledge. I love the collaborative nature of the Ontario hospitals. I think it's so great to see whether they're looking at resources, whether they're looking at, understanding how to use the platform better. I know for a fact that lots of people and lots of our groups call each other to say, how have you managed this part of the process? How are you managing escalations? How are you managing when a patient calls in with this kind of problem? Is it going to a triage point? And as much as we can help, push forward and say, this is what other hospitals do, hearing it from their own mouths just makes it that much more engaging, that much more like we're working together to make this entire Ontario health hospital system better as a group.
Mm-hmm.
I think that's one of the benefits of having a single payer system here is that there's no I'm sure there's some healthy competition between some organizations, but generally speaking, it's one healthcare system at the provincial level, and everyone's on the same page to help each other get better together. So the fact that we can help support a community is just really exciting. Congrats on that. That's phenomenal.
Yeah, it's great. And I can't take all the credit. I got asked and volunteered to start joining into these user group meetings, but all of my colleagues, we all help out. There's reporting needs, there's presentation needs, the entire customer success team, from the head of customer success all the way down to customer support, and all the customer success managers in between really did just, take this on as a group. I just got to be the spokesperson because they said, Jordan, you like to talk a lot, so you'll be in front of everyone for these ones going forward.
That's awesome. I'm curious, Jordan, so you joined actually during the pandemic, September of 2020. And, at least on my own kind of bias, we've maintained a really exceptional implementation with different partners throughout the pandemic. And so I'm curious, how do you actually go about training and launching a program while being fully remote? How has COVID impacted the program launches?
Yeah, I don't have any back experience. I don't know what it was before. What I see that works well right now, there's a lot more coordination involved, but the ability to train not on a specific day, have recordings, be able to share materials ahead of time, does make it easier for our partners to grab on and look at schedules. For example, I can have 2 or 3 training sessions for a team to look at very specific items. I can break out the teams and say, this session, we're going to talk about Seamless as an overview. Would love everyone to come and join on. We're going to record the session, ask that everyone watch it who doesn't attend. We're going to look at how to enroll patients for the enrollment group if there's a separate enrollment group. We're going to look at how to handle patient calls and inquiries. And I think what's really amazing with COVID is that digital touch. As much as I'm not face-to-face, there's still enough out there that people can digest on their own time. If I were there in person, yes, they would have my full attention, but I think giving people the opportunity to review things and see things at their own pace and ask questions at different points actually creates for more engagement. I'm able to ask, did I miss anything? Do you feel you're equipped? And questions will come in 2, 3, 4 days later. If I was on site and I missed one of those questions, it's great. Hopefully they ask me right then and there, but now it's a little bit trickier. There isn't that, do I reach out? Do I wait? Do I ask others? This gives the platform the ability to just keep going forward and retrain after the fact. If there's new members, I don't have to go back out there. Hey, come jump on a 30-minute call with me. I'll get you trained up. You'll be an expert in Seamless by the end of this call that I do, 2, 3 times a week.
Excellent. Yeah, that's that expectation setting there again.
Yeah.
That's fantastic. So one final question that we have, and we want to start asking this to every guest who is internal to the company at Seamless, who joins the podcast. So I'm curious, what do you love most about working at SeamlessMD?
I think there's 2 big pieces. Number one, I like the role. The role itself fits my needs. I'm a presenter. I like to engage. I like to work to make meaningful conversations happen. So it's not just a blah meeting. There's excitement, there's a real ask, and there's real things moving forward. And I love working with data, understanding what's going to be best for our customers. I think what's really great about Seamless is something that I've talked about, is this coming together of patient education specialists and customer success. The idea that these 2 are so closely interrelated and could potentially be one person, as they are in so many other places, just gives us that much more breathing room and breathing space to think outside the box. How can we make this process better? You're not just sitting in a silo. You're really able to collaborate with others bounce ideas off of, even though I'm supposed to be the expert in enrollment workflows, someone on the patient education side that I'm working with may have seen this that they've done 3 times before that I had no clue about, but because we're coming together at this from a team angle over that implementation to launch, it really just creates an amazing office environment, whether virtually or actually in person. And it just, I love that part of Seamless. It's great to be collaborative in general. And I'm an idea bouncer and talker, and that's what I love here.
Sweet. Josh, did you have any follow-up to that, or?
No, this is perfect for
okay.
the testimonial library we're going to build.
That's great, Jordan. So at this point, we want to wrap up the podcast. We do have what's called the Fast 5 section. So this is basically 5 kind of lightning round questions where we're going to just rapid fire at you, and you can answer as quickly as you'd like. So the first question we have is, what is your favorite book or book you've gifted the most?
So I'm not the biggest reader, but I have been promoting very heavily Chris Voss, Never Split the Difference. Never Split the Difference. An excellent book on how to really engage and negotiate. It's an ex-FBI negotiator. He has a masterclass. I listened to his podcast, and there's so many valuable insights, whether you're in the workplace or even at home dealing with difficult personalities. Really, really my favorite book so far that I've read probably in the last 5 years.
So Jordan, I mean, I hope this never happens, but if for some strange reason there is a hostage negotiation situation in the office, we can count on you to be our negotiator.
You can count on me to probably call whatever our version of the FBI is, probably because I am not going to be responsible for anything that happens.
Fair enough.
Good call. Question 2, how has an apparent failure set you up for later success?
It happens all the time. Being really clear in expectations right from the start. If you miss that mark, someone doesn't hear you, someone doesn't understand it, you are fighting an uphill battle from day one. So wherever, whenever, as long as you can continue to set expectations, reiterate the point, write it out, have them agree to it, whether it's us on this podcast, like you said, Jordan, it's going to be an hour, and have people to agree to it. If you don't do it well, you are done in ever moving forward with them.
Yeah. That makes a lot of sense. I mean, the very first podcast episode, Josh was like, we're going to spend 8 hours on this. And my expectation was, all right, 8 hours. I got to get ready for that. Turned out it was an hour, but that's great. Question 3, this one's a little bit different. Would you rather have super strength, super speed, or the ability to read people's minds?
I've always been a flash fan, super speed, hands down. Forget the ability to pick up things. If I can go around and do things 100 times faster as an impatient person, I'm doing it.
Yep, no, that's good. Question 4, this is a healthcare related one. What is something in healthcare you believe that others might find insane?
I saw this question before and I was trying to think of something, and I think the most quote unquote insane thing that I see is, I don't even know. I don't know what's insane. I haven't been around it long enough to give you that answer. So I'm going to leave it blank for now.
Yeah, I mean, that's pretty insane. So that's good. Yeah, I mean, we should say, like, nobody, you're not forced to answer any question on this podcast. We're just, anyways, no, that's good. That's fine, Jordan.
But Alan, it would be funny if someone passed on every question.
If I
even the majority of the podcast, like the real meat of the podcast, like, I'm gonna pass on that. It's okay.
I think if I were to say anything, I think just because I'm an impatient millennial, the way I do things, like I'm at a startup for a reason, it's just the pace. Like there's certain things that do take a while to move forward. I bet you it's the same at big non-healthcare companies to make like a radical change to a process to get things approved. I think especially on, I don't want to call them out, but our friends in IT sometimes, it really does take a long time to move the needle on some of these initiatives, and I just wish they were faster. But I mean, you have to go at that pace for certain reasons. You have to make sure all your checks are in balance. It's not quite insane, but something I wish would change.
Yeah, no, it's fair. I think you just made a lot of enemies in IT.
Yeah, I mean, yeah, potentially.
But yeah, I agree with that point. Actually, the pace does. I think to an outsider, it would be very insane to look at that. There are probably reasons for it. There's a lot of checks and balances and even some red tape and things like that. But yeah, absolutely.
Or blue or purple.
Yeah, blue, purple tape, all of it. Last question that we have. This is a pandemic related question. What is a new hobby or activity you've picked up since the beginning of the pandemic?
It's probably an addition, but I'm really bad with creating content. I never really liked it. But the addition of the food blog. So we were avid cooks before. My wife and I follow at Fine Foods with Finewax. Just as a quick plug.
I'll link it.
But essentially, we said at the beginning of the pandemic, now's the time. We're both at home. Let's take pictures of our food. Let's meal prep. Let's show others what we've created. I'm not so great at the picture taking. My wife handles most of that, but I have done a lot more of the writing and content creation there. So really just taking it up a notch and keeping up with that trend.
That's awesome. Yeah, we'll definitely link your actual account. I think it's an Instagram account in the show notes. The food on the page, actually, like every time I go to that page, I get hungry. So it's really good stuff. And I think you do like a daily menu or a weekly menu thing.
Yeah, we do weekly menus. We show what to cook. We show easy ways to do things. We'll do step-by-steps for certain things that are just like run-of-the-mill, like one extra step that you probably wouldn't do, but makes a big difference in your cooking methods and whatnot. So we try to keep up. It's going to be a lot moving forward. I think there'll be some changes into the content when there's eventual baby food around, but we'll see how that goes.
Amazing.
That's awesome.
Alan, quick question for you.
Yeah.
At what point will we not be able to ask this final question of what is something new you picked up during the pandemic?
I was thinking about that as I was asking the question. I may have to say, like, that period of time where you were at home working remotely for a year and a half, any new hobbies that you learned there that you've kept now into the future or something like that? No, that's a good question. Yeah. I don't know.
Cool.
Maybe
I hope
today.
we're not asking this question 5 years from now. That's all I'm saying.
I mean, like you guys are both at the office today, so maybe this question is something we retire soon.
I would change the question to
what's a hobby you picked up in the last 5 years?
No, or like maybe pandemic moment. What was your highlight and low light from the pandemic?
Oh, that's good. Yeah.
Because it's behind us. What was your highlight and low light?
Right. That's a good point. We should have Jordan on the show more often.
I don't have much more. There's probably not any more topics to say. Like I don't have much more insights to provide, but hopefully it was valuable today, and I really enjoyed being on the show.
Thanks, Jordan. No, it was great to have you on the show. You definitely had a lot of insights, and I think everybody listening can take at least 1 or 2 or 3 pieces from that. So thanks so much for joining.
My pleasure.
Thank you, Jordan.